Hello, I'm Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California at Imagine Plastic Surgery. Today's topic is breast augmentation or mastopexy recovery. Actually, the recovery starts in the pre-op time. In my practice, I offer arnica and bromelain. Both are homeopathic medications that reduce swelling and bruising post-operatively. These are started in the preoperative time. I also like to have my patients take a good multivitamin medication. This can be prescribed or this can be obtained over the counter. Now, if you're a massive weight loss patient or had any type of gastric bypass, I recommend that you have 100 grams of protein per day, 2 weeks before surgery and thereafter. Okay, the recovery starts in the preoperative time. The morning of surgery, we'll see the patient, we'll validate the size of the implants, the access incisions, the shape, the profile of the implant that we've chosen. I like to have my patients pre-medicated with a patch that we put behind their ears. This patch allows anti-nausea. It's called scopolamine, often used by deep-sea fishermen or on cruise ships. This has been shown to be quite effective to prevent post-operative nausea. Number 2, if you're feeling a little bit uptight or have anxiety, we like to pre-medicate you with Valium, a mild tranquilizer. Okay, surgery's done, you're in recovery room. What we like to do is pack the breasts in ice. I must say though that during the surgery, I inject the muscle and the tissue around with long-acting anesthetic medication. This is quite effective for the short term. If you would like, we can also insert a non-narcotic pain pump that is inserted with catheters very similar to the size of an epidural catheter. Through a little pump for the next 24 hours, 4 days, 24/7, the medication marking, like Novocaine, is constantly dripped onto your pain nerves. I have found the patients have a very quick recovery with minimal pain, combining both the injections and the pain pump. Now you're in the recovery room. We pack the breasts in ice. What I'd like to have my patients do is go to the store and buy like the Costco size frozen peas or frozen corn. 2 bags. You'll put one in a pillowcase and then put it over your breast with the bra on. This acts like a bean bag and contours to your breast. As the frozen corn or peas thaw, you can change it out with one in the freezer. Then we start our pain management afterwards. I prescribe Percocet. You'll be able to take that every 6 hours. But I also now alternate that with ibuprofen, Aleve, or Motrin every 3 hours, alternating. So let's say you're just getting home at noontime, take a Percocet. 3 p.m., take an ibuprofen, Aleve, or Motrin. 6 p.m., you're going to take a Percocet. 9 p.m., Aleve, Motrin on the steroidal. Okay, now we're dealing with the pain. The first 24 hours, I just want you to take it easy. The next morning, we'll see you back in the office. We'll make sure that everything is okay. Then we start our displacement exercises. To get the shape that you like, we're able to attain that intraoperatively. But because under the muscle, when you start to wake up, you get tension in the muscle, and that pushes the implants up and out. And we want them down and in to create the breast that you would like. So we call it our 5-5-5 programs. 5 minutes a day, you'll displace the implant centrally to stretch the muscle to get cleavage. If one sits too high, you press it down. If one sits too low, you press it up. Then we'll go ahead and massage the breast gently. 5-5-5. 5 minutes a day, 5 times a day for the first 5 weeks, or until you get the shape and look that you want. Now we have a variety of straps, we have splints, we have T-bras, we have a variety of external devices that we can put on your breast to help you get the look you want. We want to see you regularly to make sure that everything looks well. Now, the sutures that we use are totally absorbable. At the end of 5 to 7 days, we'll take those steri strips off, a bandage. Then we begin our anti-scar program. This is taking silicone gel. Some of the different companies are Biodermis gel. So with these, you will put the strip on over the incision, and you will take it off only to shower, to exercise, or for intimacy. Otherwise, for the next 3 months, you'll leave that on 24/7. Now, fortunately in our practice, we have more lasers and technology to treat scars, but I would rather prevent the scar. Now, most people are back to work in 3 to 4 days, based if they're not doing heavy lifting or manual labor. So, what do we do? The first 6 weeks, I allow my patients to go back to the gym and do exercises as long as it doesn't hurt. So, if you want cardiovascular, I ask them to use a stepmaster or an elliptical trainer, non-high impact. Then, after 6 weeks, you can do any exercise you want. During that first 6 weeks, if you want to do light weights, that would be fine as long as it doesn't hurt. But after 6 weeks, there's no restrictions. Now, long term, what do we do? After the 6 weeks period, the breast implants have seated, you've got the look you want. I tell my ladies at least 3 times a day, I want you to do displacement exercises. With soap on your breast, take the breasts and move them around in the shower. When you go to the bathroom, you move them around again. Every evening, before you go to bed, you move them around. I want you to get a understanding of what the normal breast feels like. Why? If you start to develop a capsular contracture or a hardening of the breast or pain, I want to know about it earlier, because we have several non-surgical treatments, including the zirconium laser, to go ahead and treat these non-surgically. Maintenance. Now, if you're a saline breast implant, you don't have to do anything else. If you're a silicone gel gummy bear implants, the Federal Drug Administration, the FDA, recommends that after 3 years, you get a non-radiation evaluation using an MRI, magnetic resonance imaging, to make sure there's not a rupture. Why? The new silicone gel implants are gummy bears, and you may not know that they're ruptured. Then the Federal Drug Administration recommends every 2 years to treat it like that. Now, these implants are all guaranteed for life. What does that mean? That means if they ever rupture, all the companies that we have will replace the implants at no charge for you. In addition, they'll provide a stipend to help defray the cost of anesthesia and OR. Now, this is very rare to happen, but this is just another point in evidence to say how good these implants are and the integrity of the companies that make them. Okay, so in summary, post-op recovery begins in the preoperative time, taking medication for anti-bruising, anti-swelling. We discussed pain relief, we discussed displacement exercises, we discussed exercise, and we discussed long-term treatments. I hope you found this video helpful, and I wish you my best.